how a modern T4-style program could be implemented using DNA collected from COVID PCR swabs. If governments use COVID PCR tests to collect and analyze genetic data, they could implement a T4-like genetic selection process without direct extermination camps. Instead, it would be done through AI-driven medical policies, invisible euthanasia, and selective exclusion from care. Step 1. Mass DNA collection. PCR test swabs as a cover. COVID-19 PCR testing provided an unprecedented opportunity to collect massive amounts of DNA under the guise of public health surveillance. This genetic data could be stored, categorized, and analyzed for specific markers of disease susceptibility, longevity, intelligence, resistance to bioweapons, or undesirable traits. Epigenetics complicates this. Governments could target groups based on predisposition rather than definitive genetic diseases, making detection harder. Step 2. AI-driven healthcare rationing and targeted soft extermination instead of overt killings. Modern T4 would work through controlled healthcare access. AI-driven triage systems like Epic, Cerner, and insurance-based predictive models could flag certain individuals as low priority for treatment. AI algorithms could deny or delay care for those with genetic markers deemed undesirable, e.g., high cancer risk, immune resilience, mental illness, or cognitive divergence. Covert sterilization programs could be implemented through gene therapy, vaccine-induced infertility, or hormonal manipulation. Step 3. Economic and social exclusion based on genetic risk. People with specific genetic markers could be excluded from job opportunities, insurance, and social mobility. Precision medicine policies could disguise discrimination as personalized healthcare, denying resources while claiming it's for the patient's safety. Genetic credit scores similar to China's social credit system could control access to loans, travel, and services. Step 4. Silent depopulation via synthetic biology and genetic targeting. If governments identified specific genetic groups to eliminate, they could use RNA-based bioweapons or viral vectors that selectively trigger autoimmune diseases in targeted populations. Environmental exposures, chemicals, food additives, and synthetic hormones that selectively weaken fertility or immune response in specific genetic groups. AI-driven predictive policing that preemptively labels individuals with genetic risk factors as unfit for certain roles or responsibilities.